Tired, painful legs, which feel like lead pipes at the end of a hard day at work? Do you suffer from cramps and restless legs at night that wake you from your sleep? Itchy legs and developing a brown color like a suntan with wounds and scratches that take a long time to heal? Are your ankles always swollen at the end of the day with bulging veins on your legs? You may have a condition called varicose veins or chronic venous insufficiency. Varicose veins is a progressive condition and prevalence increases with age. I'm Tjun Tang and I have treated patients from the age of 14 years old up to 92 years old with severe truncal reflux and varicosities. Contrary to misconception, the prevalence of varicose veins in men and women at any particular age are broadly similar. Working in certain professions that involve long periods of standing or even sitting down can cause this condition to happen and worsen. Professions susceptible to developing vein problems in the legs are typically those people in the retail line. These people generally stand up for most of the day, 8 to 12 hours per day. This may not be helpful to your veins or legs. People in the F&B industry, such as restaurateurs and chefs, for the same reason, architects, nurses, and even doctors. Moreover, sedentary lifestyles may increase this risk because inactivity may impair proper blood flow from the legs. Most people have seen or heard of them, but what exactly are varicose veins? Well, varicose veins are abnormally dilated veins which can be seen on the skin surface of the legs, ankles, feet, especially upon standing. They are blue or purple in color and can appear lumpy, twisted, or even bulging in nature. They are caused by damaged valves within the veins, and when the vein wall loses its elasticity, which results in blood moving backwards against gravity, i.e. the wrong way, and pooling in the legs. This condition is known as venous reflux and is considered as a spectrum under chronic venous insufficiency. We do not yet have a full understanding why this exactly happens, but there are certain risk factors. Genetics, especially in females, do play a role to some extent in aging and pregnancy. Vein issues, especially in the legs, are more common than you think and affects millions worldwide, especially as you get older, and it can affect people even in their teens. They are affected by a number of other common conditions which are becoming more prevalent in Singapore, such as diabetes, obesity, and coronary heart disease. There is an estimated 97,000 kilometers of vasculature in the adult body. And if they were all to be laid out in a single line, which could circumvent the Earth, approximately 40,000 kilometers, twice over. So you can imagine there are many potential points of problems in holding up blood supply. Problems that affect the muscle pump efficiency of the calf, like osteoarthritis of the knee and poor mobility, are associated with both varicose veins and chronic venous insufficiency. So what symptoms do varicose veins cause? Well, varicose veins, as a result of venous reflux, may not cause any symptoms, but are unsightly. However, more commonly, our patients report a wide range of symptoms, including aches and heaviness, especially towards the end of the day, restless legs, especially at night, pain, even itchiness around the legs, or throbbing or burning sensation over a prominent vein or a particular area of the leg, especially the calf, swollen ankles and feet, especially towards the end of the day, and muscle cramping that is particularly worse at night and can keep them awake. Also dry skin and color changes in the lower leg, especially the brown pigmentation and some redness, which you may mistaken for a suntan, especially in the temperate climate. So varicose veins is not just a cosmetic issue. it can lead to other health complications if left untreated, which includes both bleeding, inflammation along the veins, which is called phlebitis, blood clots, and skin issues, especially infections, which is called cellulitis and eczema. If all of these are left untreated, this can lead to venous ulcers. These are wounds that are not healing, especially around the ankles, and the potential, even if it did heal, for recurrence. But the good news is that with the right treatment and care, varicose veins and their associated complications can be treated. At the Vascular and Endovascular Clinic, we offer a full range of effective vein treatment options, a complete solution based on the International National Institute of Clinical Excellence and American Venous Forum guidelines for patients with varicose veins. Traditional open surgery can be painful and demands a significant amount of downtime. Therefore, we offer an array of what is now known as minimally invasive or keyhole venous procedures as an alternative to conventional open surgery, including endovenous thermal ablation techniques such as laser, radiofrequency ablation, and even microwave ablation. We also offer non-thermal options such as cyanoacrylic glue, and this is otherwise known as VenaSeal, and mechanical chemical ablation, MOCA, or Clarivane ablation. Sometimes we do offer these mainline therapies along with foam sclerotherapy and what we call ambulatory phlebectomy, whereby we've removed the small little veins or branches in the same sitting. Everything is done through a pinprick incision that doesn't even need a stitch in most cases. Patients are back to normal within the next 1 to 2 days. They can walk immediately. Most of these procedures can be done as day case procedure and even under local anesthetic and sedation. And what this means is that you do not need a full body general anesthetic. Pain post-procedure is minimal. If the worst amount of pain was like 10 out of 10, this is like a 1 or 2 out of 10, and you'll be walking out of the operation bed immediately. So do you need a venous evaluation? Well, a vascular specialist evaluation is necessary to determine the underlying cause of your varicose veins. Your history, a thorough examination of your venous system, and an ultrasound scan are all used in determining the type and extent of treatment you require. A duplex ultrasound is required to determine the extent of venous reflux in your veins, the severity and anatomy of your varicose veins, and which can guide the vascular specialist to offer you the best treatment choice. This is mandatory to detect any problematic veins before any type of surgery is considered. So if you or someone you know is experiencing worsening symptoms such as tiredness, fatigue easily after a day's work, heaviness in your legs that feel like lead pipes, ankle swelling, restless legs, cramps especially at night time, new pigmentation in your legs, it will be time to seek a vein evaluation by your local friendly vascular surgeon. Do seek vascular specialist treatment early. We can help you to determine which veins are faulty and which ones are causing circulatory problems to target which veins you need treating. We provide a wide range of treatments for your vascular health. At the VEC, we are committed to providing the care and attention you need. I look forward to improving your vascular health and well-being today. Thank you.